So we are live, and we are ready to start a discussion on retiree health benefits, and we are seeing whether it's showing up yet. So if you are joining us and can just type a message that you can see us, that would be great. We're intentionally starting it a minute or two early to give people a chance. Okay, so some people are on. If you joined us and you are able to, please put a comment in if you can hear us and see us. Okay, well, people are joining it. That's a very good thing.
So you can see that, but I won't. Is that correct, Paul?
Oh, there we go, Debbie. Okay, Debbie and Linda, thank you. Can you see the comments, Lisa, on the right?
Um, oh, I see. I need to turn it from private chat to comments. Got it. Okay, I can see that. Oh, great.
Excellent.
All right.
This means it's working. I like that.
Oh, excellent. Okay.
Okay, so I'm going to turn that off. So I'm only going to be looking at these comments here. Lisa, I always say this is sort of like the popcorn popper. Once the number of attendees stops increasing, we know that it's time to begin. And
Okay.
I'm up to 16. Are you able to see the count there, Lisa, top left?
Um, Actually, I just see comments. I see 4 people.
Oh, okay. You don't see on the top left a red live with a clock and then a eyeball and a number next to it? The top left of this StreamYard.
I see the live, but I don't see the eyeball with the number.
Okay, no worries. We're up to 20. It's still
Okay, great.
increasing, which is nice. Screen and entire screen.
See, some people are. I can see some folks coming in.
Yep, it's still increasing. Up to 26 now. Everything's frozen. So Linda, let us know if it unfreezes. And if somebody else sees it frozen, can you comment there also, please? There we go. Very good. Very good. So if anyone else sees it frozen, just let us know, please. Up to 30, 32. It is nice when technology works. Okay. Yeah, I did a Zoom on, I don't know, Sunday. It couldn't have been a few days ago, and my audio cut out after about 40 minutes, and I didn't realize it until 20 minutes after that. Linda, it seems as though, sorry, Linda Wasco, it seems as though you're the only one who has it frozen based on comments. Yeah, Linda Olson. I do have the bills on a different screen. I'll bring them in at some point. I was testing things out. Okay, 39. Lisa, you're a draw. I don't get this many people.
No, you're the draw, Paul.
Right. I'd say that at 5 after, regardless, we should start. Okay.
And Paul, there's a number of people I know who are not on Facebook, And so once you put this up on your YouTube uh, channel, I know people will be able to go there and view it. They just won't be able to see the comments. Is that correct?
That is correct. And so
Okay.
therefore, when we are responding to a direct comment, um, we should repeat it where possible for that purpose. Okay?
Okay. I do have to say, just because of my vision problems, I generally I can kind of see what's going on there, but I'm not the best at reading um, small print these days. So it is
No,
what it is.
no problem. I will take care of that. And I'm putting in the address of the YouTube page where my
Good.
stuff is posted. Um, and I will also make a post on Facebook. And my guess is that Anne Marie will also do the same thing. We're up to 50. That's a half century. I like this. Um, well, Lisa, I think we can start talking, and we'll get to guts in a bit. But why don't you introduce yourself and talk about what you're hoping to achieve this evening?
Paul, thanks for setting this up. I'm Lisa Diller with Rise Delaware, and we have a lot of folks who have connected with us through our email list, through the Facebook group, who are very interested in knowing how they can assist with particularly the promotion of HB 281 and 282. And I think that they're interested in learning a little bit about the process that you're going through as a legislator here and how they can be helpful. I think folks who have been involved with RISE have taken really seriously the whole idea of being good civil communicators with legislators and have gone out of their way to be polite and try and provide information based on their personal experience and relate it to the legislation. So I think folks have been, very participatory where they were asked to be involved in both the process with the RHBAS, the SEBC, and now we're sort of in another phase with the legislation that you've introduced. And I know people are wondering, how can they be helpful? How can they be the most helpful? And of course, one of the ways that we've promoted since the very beginning is communication with the legislators. So give us a little background, like when is it helpful to communicate? Because I know that these bills are not likely to come up, this month because they're still in Joint Finance Committee hearings. So can you give us a little background on the process from your end? And that might help folks understand where they can intervene and the time that's really appropriate to do that.
And that's great. And Lisa, thank you, and thank you for the invitation. So I'm State Rep Paul Baumbach, the Newark area, and also the House Democratic member of the RHBAS subcommittee that, along with the public, suffered through 20 meetings last year. If sometimes I've got an attorney, there's an attorney down at Legg Hall who actually has a little Schoolhouse Rock figurine of how a bill becomes a law. And I'm only a bill thing. Same as in Congress, in our case, we have 5 steps. Once the bill is introduced, it has to clear. Where's the camera? There we go. Has to clear one committee. In this case, the House Administration Committee.
Mhm.
When it clears that, it has to be scheduled to be heard on the floor of the House and get enough votes there. The third step is it's assigned to a Senate committee, has to clear that committee. It then goes to the Senate floor, needs to clear that. And then finally, it needs signature of the governor. There's other mechanisms there. We're at step 1, where it's currently assigned to the House Administration Committee, and we're hopeful that we can get that committee hearing. I would think March is reasonable. I think we're in session for 3 weeks in March, and hopefully we can clear the House Administration Committee then. And I'm not in control of those steps. I chair a different committee. And I do have some control over that committee, but the House Administration Committee is not one that I lead. So However, I speak with my colleagues, including the chair of that committee, the House Majority Leader, Minor Brown. And let me bring up let me bring this piece up. Okay. The most important piece here on this page, which is House Bill 281, is this gigantic block of a whole bunch of names. We have 62 people in the legislature, 41 representatives and 21 senators. Of the 41 representatives, I think we've got 27 of them on this list, including one that was added in the past week. Now, you can get a lot of names on a bill if it's like, let's be really happy that Mother's Day is coming up. That stuff gets lots of names. Most other bills take a lot more. And this is one that, frankly, let's see if I can, no, I want to get both of us, that took a bunch more, and it's because of several things. But I'll say it also, let's face it, RISE and the participation of the retirees is what drove this. So the case was made in 2022 in the summer, all in 2023 during all those public meetings we had, attendance at rallies locally and down in Dover, and very importantly, the outreach from retirees and current employees and spouses of each to their legislators. The most effective way to impact a bill is to speak to your own senator and your own representative. It's not the only way, but it is the most. I'm a rep. If I have somebody reach out to me from Milton or Milford or wherever it happens to be, I'm gonna, if it's an email, I'm gonna scan it really briefly. If it's something I love, I may get back to them. Something I hate, it's like, you know what, I serve 20,000, 25,000 people in Newark. I'm going to focus my time there. So it really makes sense. You're going to have much more impact on your own senator and your own representative. We've already got 2/3 of the representatives on this bill. So 2 out of 3 times, the likelihood is twice as good that your representative is already on the bill. Lisa mentioned being respectful, being civil, being constructive. And I cannot emphasize that enough. I can't reinforce that enough. The theme should always be, hi, I'm so-and-so. If it's the case, I am your constituent. I am an employee, a retiree, a spouse of one. I care about it as a public policy. I worry about keeping the state, having enough people, having enough police officers on the streets, enough nurses in our public health facilities, et cetera. I care about the workforce here. And I'm convinced that if we move back to that Medicare Advantage, that we won't be able to achieve that. It may also be that you are offended. That may be stronger than you should say, but I think you probably are, at how this all went down, very behind the scenes, very in the shadows. And we've got 2 bills to address that. House Bill 281 and 282. So if I'm reaching out to the legislator, hi, I'm your constituent. I'm reaching out to you because of House Bill 281 and 282 about employee and retiree healthcare benefits. And it's fine to say, I don't know if you're already signed on. Don't assume yes if you haven't checked. Don't assume no if you haven't checked. It's fine to say, I haven't even checked. It's fine to say, I'm not sure if you're on it. If you are, thank you so much. If not, and here's that staying civil and respectful, I'd encourage you to give it a read and give it a look and consider signing on as a co-sponsor. And even if you're not that comfortable, then please consider voting yes when it hits the House floor. That's the spirit that you want to get across. I'm not a gigantic fan of form letter paragraphs that everyone sends out. Because I've gotten them for, I'll say, good causes and causes that are less exciting to me. And it is easier for a legislator to not give them as much attention as you would like. And that's why I say, make the message yours. Introduce yourself, give one reason why this matters to you. Mention the bills in particular. You can say, I'm not sure if you're a sponsor. If you are, thank you. And if not, I'd like to encourage you to sign up. That's the thing you want to really focus on. And then just, close. Thank you for your time. Jane Smith. So that's the outreach I'd suggest. Lisa, before I go back to you, I want to just see if there's questions that, because I saw one is, what do you do if you're an out-of-state person? And I had somebody reach out to me today about their out-of-state. So if you're out-of-state, that's less easy. And you're going to most likely have less of an impact, but I think there's still a good message. So, I think you can appeal to the heart and say, how would you feel if 15 years from now you're retired and you've moved to Arizona, and the legislature 15 years from now pulls that out from under you? It's something you had been counting on. Well, that's me. That's me today. And I would like you to take action today so that doesn't happen to me today and you tomorrow. Please support HB 281 and 282. That's how I would approach it. Who do you reach out to? You do not send an email with 62 recipients to every senator and representative, and never ever do a reply all to that kind of email. But it is. By the way, I'm being really careful. I don't want anything to happen from here that a colleague comes back and says, Paul, what the heck you did? You unleashed the hordes on me or whatever. So, it is, I want to be gentle, and I'd like you to be gentle when you reach out to my colleagues. But I think reaching out, since the bill is in front of the House Administration Committee, which has 5 members, if you're out of state, it's reasonable to send an individual email to each of those 5 and share something along the lines that the structure that I shared, but in your words, that ties to how you feel about that. Right. So, and Paula mentions also she lives out of state. Who should you? One thing to consider, Paula says that she's served 36 years at Colonial School District. And thank you, Paula. But you live in Pennsylvania now. Who should you contact? It's reasonable to reach out to the legislator who serves the community. If you lived in Delaware when you worked for many of those 36 years, I would reach out to maybe the legislator that currently serves the communities of the school or schools that you worked in. So let's say it was William Penn, then you find out that whatever representative serves the area around William Penn High School, then I'd reach out to them and say, yes, I live in Landenberg, but I spent 36 years serving Colonial School District that you represent, and this matters to me. So, try to find that bridge to connect you and the person you're writing to, and then share the issue and share why it matters and share what you'd like for them to do as respectfully and with as much courtesy as you can.
And Paul, when should these letters go out? I mean, certainly not until March, right? Because you don't want people to get these emails or letters too early and then forget about who you were and why you sent this. So, any timing?
So it's a good question, and I'm actually going to push back and say I'm not sure that early is bad,
Okay.
because to me we have an intense 5-month period between now and June 30th, and I think that if there's a steady stream, not flood, but a steady stream of outreach to legislators saying, what, last week I got 5 more letters, all asking me to support this, and another 5 this week. You know what? Okay, darn it, I'm going to sign on and be a co-sponsor, or I'm going to commit to vote yes on it. As opposed to, there's a chance, and let's talk about the media also. You mentioned letters, emails. I want to tell an embarrassing story. I got about 14 letters from students, and how did I know they were students? They may have said they were students, but they were all U.S. mail letters, and they did have return addresses, but there were no email addresses. Now, I'm not going to write 18 letters. I would write 18 emails, in 5 minutes. I had no problem with that. So if you want a response, you want to make it easier for them to respond. So I think email is effective. I would say it's less effective if you're using the same paragraph that 19 other people are using. So write it yourself. You can send the same thing to 5 different legislators, but I would suggest you not use something that 100 other people are using the same words. Use it in your own words, use your own voice. I think email's best. Um, and as far as when, the challenge is, I you know, it's not that I'm typical, but I'm not atypical. There's times I've got a busy week. I'm not going to get to my email until the weekend, and I try to get through the ones that came in the past week on Saturday and Sunday. And if you wait until the day before the hearing, I may not see it until the following weekend after the action's happening. So I wouldn't try to get the timing perfect. I'd say when you have time to write something genuine, that's the time to write it. And I think that this is going to be, to me, a front burner issue for the next 5 months until we have it become law. So I don't think you can be, from this point forward, I don't think you can be too early.
Okay, that's really helpful to know. And I think the whole point of, it's been a source of frustration for people who live out of state as to what to do. I love the idea of writing the members of the House Administration Committee, and I would be happy to put this on, you know, out to the email list, and maybe Anne Ray can get it up on Facebook, the members of that committee, so people know who to write to. I think that would be great. That's a very good solution for people who don't live right in this, right in Delaware. Um, and Paul, you've said it might be even more effective if there's this steady drip, drip, drip. So if you don't get the email out this week, it's really okay to just keep emailing. Folks can just keep emailing. And as soon as we find out that this thing is going to a hearing, I mean, of course, we're going to let people know. But in the meantime, just letting these folks know that there's support, a lot of support, not just a little support, a lot of support out there for these bills would be helpful, is what you're saying.
Lisa, I've got, yes, and there's two questions I want to address. One from Lynn Anderson is there any point of contacting Governor Carney? Absolutely, yes. It's always, I would never say that you should not contact somebody. And as I mentioned, getting it signed by the governor or past the governor is our fifth step. It is important. Civil, constructive, positive, appeal, find something in common. And if you're a teacher, his father is a teacher, so you've got something in common to talk about. So, make that bridge, raise the issue, encourage him to, give more thought to supporting, retirees, their spouses, current employees, when they become retirees, and again, respectful, civil, constructive. I think that's really the key in there. Jenny asks, can you or someone type in the chat? Sorry, no, I already did that one about the bills, 281, 282. There was a second question. What's the best way to have an impact if our state senator rep are already bill sponsors, so we don't need to encourage them to support it? Leslie asked that, and the answer is thank them. And trust me, we usually hear from the squeaky wheels, the people who are unhappy. It is helpful, and it really makes a difference just to thank them. But it's more than that. In addition, um, without naming, there are those who do not support these bills. Okay, and they're going to the people who've already signed up and saying, you know what? Why don't you consider taking your name off? Why don't you consider, when the vote comes up, walking out of the room and not voting? Not coming to the house that day. So even though their name's on there, it's still helpful to reinforce that decision they made to be on it in the first place, and to encourage them to resist any temptation that comes, any pressure that comes, to not support the bill when it matters the most, voting it out of committee and voting it across the House floor, or same in the Senate side. Great question, Leslie.
And Paul, would it also make sense, if folks have not met their state rep and state senator, if there are opportunities like coffees to, maybe a morning coffee like you have, for folks to go there and introduce themselves and just say, I've written you a letter on this issue. Just want to remind you, we want your support for it. Again, civil, but kind of like the dripping faucet. You just keep showing up and you keep dripping on them to let them know there's support there for these efforts.
Yes, indeed. And keep in mind, sometimes those are live streamed and therefore they have a life beyond that day.
Right.
My coffee, my next coffee is this Wednesday, 7:30 to 9 at the Deer Park. And it's a monthly coffee. And I know that I think Representative Ramon, he may even have two a week. I mean, he's got at least I think five a month. I think that's the case. And I think Representative Michael Smith has several. And I'm mentioning ones who are co-sponsors. I'm not throwing. No one's on the naughty list. No one's, if they're not there, it just means they're not there yet. Okay, so everyone has promise, and I'm hoping that indeed we get an overwhelming vote in both chambers, and we get them out of both committees nice and smoothly. Um, and I lost my train of thought because I was looking at the questions. Lisa, what were you on right
Well,
then?
we were just talking about moving from letters to personal interaction with people,
Yeah,
just to let them know that we're concerned. And if you have that opportunity to have that positive interaction with folks, it doesn't hurt to take that opportunity and talk to them.
absolutely. And I mean, keep in mind when you go to a coffee, you're not only influencing the legislator, you're influencing your neighbors. And your neighbors, it may be hard to believe for the people watching here, the 77 people watching here. Not everyone in this state knows what RHBAS stands for. Not everyone in the state knows what SABC stands for. And not a lot of people in the state know what House Bill 281 and 282 are. We do, we know it deeply, but some of your neighbors don't. That's another reason to raise it at a coffee, at a meeting, a community meeting that your representative and or senator are at. I mean, don't if they're doing a meeting on flooding, area flooding, don't go and be a troll and try to redirect it over to 281, 282. Important issues, but the meeting was set up to talk about flooding. Okay, but if it's a community meeting, everything's on the table, and it's completely reasonable to say, Representative, whomever, could you share your views on 281 and 282? I'm a state retiree, and I'm really concerned about my future benefits that I had understood during my 36 years of service at Colonial School District. When you get that personal story as part of it, people's ears stay open, and they're going to listen more. And especially if you start infecting your neighbors, and they start saying, "Oh yeah, what do you think?" And that absolutely can influence a legislator, or if they're already on, that can strengthen their resolve when they get pressure to soften their resolve.
Right. I mean, I'm just concerned. I mean, we have seen this sort of backdoor maneuvering going on without saying anything more about that. But so I think the fact if folks from Rise who are interested in this issue can make those personal connections and just remind folks in a respectful way that they're out there and they're watching what's going on in those opportunities, that would be really great.
Yeah, I'm double tasking, and someone said what's Rise, so I'm required to post in here a link to Rise's Facebook page. So Rise is an organization, and Lisa's co-founder of, that was formed to address the deep concerns when the retirement health plan for Medicare age retirees was proposed to be changed as of January 1st of last year. And court case was involved, and a lot of they've done an awful lot of work. So that's what RISE is. It stands for well, actually, Retirees in Search of Equity.
Investing in social equity. Yes.
Okay.
Yes.
Hey, it's right there. Could have read that. Okay, so I got that question. Double state share. Gene Moore asked about this. Uh, Gene, I know the concept. I can't quote the details. And so let's talk about what these bills do. And I'm going to get a little wonky. But stick with me. It won't be too painful and it won't be too long. So I'm going to start on 281, and 281 is the Medicare Advantage bill. And the important part of it, although it does actually here, Jan, it talks about the 50% share. And I think that this is the double state share. Again, I know some about it, but only enough to be dangerous. It doesn't make any changes to it. But what it says is that it takes out reference to Medicare Advantage, and it restricts Medicare age retiree health plans to Medicare supplement plans, also known as Medigap plans. The current one the state provides is known as MedicFill. So it takes advantage, it strikes it out here on line 35. You're not going to be quizzed on this. Anytime we saw Medicare Advantage in here, we struck it out and we put supplement in, as you can see on line 32. That's all it does. Is Medicare Advantage is also known as Medicare Part C, and says it repeals the option so that the committee that decides what plans to provide to retirees who are Medicare age are not allowed to consider this Medicare Advantage plan. With that, I want to bring a little table over, because one of the things that I hear, I'm not sure if you guys hear it, is, well, we have to keep Medicare Advantage on the table because it's the only way the state can save money. If it sounds like it's crap, because it's crap. So MedicFill is here, and it costs, and this is to the state, the total cost for just MedicFill, not for the prescription drug, is around $3,282 per covered person per year. The employee typically pays 5% of that, $164. This is over a year. Now, if we chose to go at some point, and typically if we make a change, it's not for current retirees. It's for people who retire after a certain point, or people who started work as of 2015 or 2025. At some point in the future, we have a hard line and say, after this point, here's what the benefits are. If we change to Medigap G, we would save the state and save retirees about 16%. So we can save dollars without going to Medicare Advantage. If we go to Medigap L, we could save 38%. And this is really simple. Two little Medigaps that we looked at in the subcommittee. So Lisa, what's your guess of what the savings would be if we went to Medicare Advantage?
It would be hard for me to know. I mean,
it would be 95%.
Yeah.
The cost, instead of paying $3,000 a person per year, it's less than $160 is what the state would pay. And they're saying and actually the state negotiated so they wouldn't have to pay a penny for Medicare Advantage. They would only be paying for the prescription drug plan. And they're calling it a benefit the state wouldn't be paying, or would be paying 5 cents on the dollar for. Does it save money? It sure does. Does it give benefits? Well, you tell me, if something that's free, how much that's given you.
And that's been the argument that people have had, is that, can you really call this a benefit if you can get it, basically for free? Yeah. That's the question. Yeah.
So 281 takes Medicare Advantage off the table. So what's 282 do? 281 addresses that, oh my gosh, you're changing what's going to be available to me when I turn 65, and I've put all these decades into service to our state. And says you can't do that switcheroo on us. No, just plain no. The second piece is 282, and this addresses the problem of, you guys did this without anyone knowing, and how dare you do it without people knowing? So this is the Bring Sunlight. This is the Accountability and Transparency Act for the State Employee Benefit Committee, known as the SEBC. So if I go back to bring it up on the screen, so it does a few things. It changes the makeup some. It makes the head of the budget office be the chair, and I'll just say it does that. I won't give the backstory. It adds one retiree as a voting member, and it makes sure that both retirees are appointed by the legislature's leaders, not by the governor. The governor already has some cabinet secretaries on it. So we wanted to better balance the power within the State Employee Benefit Committee. So we took one cabinet secretary off, and we added one retiree to the makeup of that committee. So that was the first change we made. I'll get to questions in a minute. I want to finish this first. The details here, the chair is the budget committee. And then starting on line 35, it points out that the committee will choose its vice chair, but it can't have a second cabinet secretary as the vice chair. So we can't have both the chair and the vice chair, both reporting to the governor as cabinet secretaries. Again, we want better governance, better accountability, better transparency. So that's one very important piece. We this stuff is important, but it's details that don't matter all that much. One of the really important point here is when number 4, when the SCBC is choosing a health plan, and they're going to put out a request for bids. So they're going to say, insurance industry, give us some quotes for helping our current employees, our retired pre-65-year-old retirees, or our 65-year-old retirees. Give us some quotes for some health plans. It says that call for proposals, known as a request for proposal or an RFP, we, the people who are going to be affected by it, 30,000 retirees, we like to see what you're asking for. Especially, we want to know if you're changing something. So we want to see that a week in advance, just like any public meeting, you have to put the agenda out a week in advance. This says if you're going to be asking for our plans, proposals for our health benefits when we're retired, we want to be able to see what you're asking for a week ahead of time. This was done in deep secrecy. Even when we requested this of the SCBC last year, after we had this court case, a judge saying you did it wrong, all this sort of stuff, they still refused to do that, to share it ahead of time. We said, if you're not willing to do it, if you're not going to do it willingly, well, then we'll change the law. And that's what 282 does, is it makes sure that we require accountability and transparency in this process. And that they have to vote for it. They have to approve it in person in a public meeting. So they're going to be on camera when they vote for it. So if they're going to make a change that's they may need to save a whole bunch of money. Okay, we may have a terrible financial situation 5-10 years from now, and they may need to cut the benefits. Well, you know what? Show up for the meeting and vote. Make the vote in public. That's what governance is all about. And that's what open governance is all about. The last part, I love this part. So RISE, the organization, brought a suit against the state, and in one of the arguments, RISE said the head of human resources, the secretary of the Department of Human Resources, didn't tell the retirees what changes were happening. And literally, the state's response was, we're not required to. We're only required to keep employees notified. Here's the code. The Delaware law says we have to keep employees notified. We don't need to tell pensioners, retirees. Well, you know what? We're changing the law. That's also what 282 does. So that's why we call it the Delaware State Employee Benefit Committee Transparency and Accountability Act. That's 282. Sorry I got wonky. That's what sometimes legislators are apt to do. Lisa, comments before I go to questions?
I would just say, Paul, thank you for the work that you've done on this. I think the thing that was most frustrating to many people who watched this unfold last year was the lack of transparency and really the unwillingness to accept that people had a right to know about this and not to do things the way they did it. As a matter of fact, that's how the lawsuit was really won, on the fact that they did not follow administrative procedures. So I think this is very helpful. I know you feel it's kind of wonky, but let me tell you, having been in this for over a year and a half, it doesn't feel wonky anymore, because if you don't lay out what needs to be done very specifically, it's way too easy for this stuff just to be ignored and swept under the rug. So, the call for transparency in this is really great. And we thank you for that. But I think, for folks who may not have been in the weeds of this, maybe they have some questions, and you can just check that out and see if there's anything that people are asking of you, Paul.
Sure. So Jill asks, should we email or contact representatives and senators, even if they're not our own reps? So if you're out of state, frankly, darn it, you should have to write to somebody. So I think that you should reach out. I think if you are not in the state, I would reach out to members of the administration committee. the 5 members of the House Administration Committee. Otherwise, if you're a resident, reach out to your representative and your senator is my suggestion. And you can reach out to the members of the House Administration Committee, but I'm going to, if there's 200 constructive, civil, respectful emails to them and 2 angry ones, those 2 angry ones can destroy everything. So do not beat up on my colleagues, especially if it's members of the House Administration Committee are the leaders. They're the 5 leaders that we've elected to lead the House Democrats and the House Republicans. Please don't beat up on them. If you do, they'll be angry at me, and that will make it really hard for me to get the bill done. So please be nice.
We just want to stress that people want to be constructive when they make those contacts. And we don't want to create problems for you because we appreciate the legislative work. So we'll just leave it at that. Okay. Civil, constructive.
Good. Now let me see what other questions. What's the amount? Karen, if you can comment what you're asking about, you said, please repeat that amount. I can put the numbers chart up in a minute. But let me go through the other questions. Do not know how long Med Advantage would stay that law. There's one of the things that I'll hear is that, even if somebody who opposes these bills will admit that Medicare Advantage is a bad solution for Delaware's retirees today, they would say it might get better tomorrow. And it's true. We may all of a sudden have a Congress that does things. And one of the things they do may be improving Medicare Advantage. And if that's the case, a future legislature can come back and do stuff. But that's going to require a public action and a public notice. And there is a lot of, we miss stuff. I miss stuff. There's a thing called epilogue language. Some of you, I think, may know about that and got kind of frustrated by the whole system there. I don't think anyone for years is going to not pay attention to that epilogue language who cares about this issue. If Medicare Advantage gets better, if it, I'm sorry, we don't know if it's, how long it's going to stay that low. I'm sorry, Linda, you're saying my $157 a year for Medicare Advantage, that's the average cost for Medicare Advantage today in Delaware per person per year. And indeed, I was at the meeting, I think I caught virtually the meeting in Goldie Beacom. I don't even remember if I was there anymore. But the person from Highmark was pretty much saying, we're charging low so people get in there, and then we'll make some profits in future years so we bring our price up. So indeed, it is low. It would be a sharp dollar saving immediately per year if we did it. But indeed, that price may inch up, quote, once they've got you. Very good point, Linda. And the state was going to share, should be contacting members of the Joint Finance Committee. So John, there we go, John Kowalker. I think I've heard that name before. So John asked, should we be contacting the JFC members to support adequate funding? So my understanding, as I've seen it, is that these bills don't have any fiscal note. They have no financial cost to them. There's no cost to making things be in the public part of a meeting. There's no cost to the state of having people vote for the RFP in public. So 282 has no cost. 281 saying it's not going to be on the list. The SCBC is deciding now for the retirement plan for 2025 and 2026. And even so, the likelihood of a plan coming through and affecting the first 6 months of 2027 is very remote. I don't think these bills are going to go to the Joint Finance Committee, John. It's a great question. We have another bill that's not yet done regarding the funding for retiree health benefits to have a match for payroll. That's going to have a big fiscal note. That needs to go to JFC. These 2 bills do not. So I don't see a need of reaching out to the Joint Finance Committee members on 281 and 282. Again, a great question, though. Shift the payments to retirees. Well, so Linda says it would probably shift the payments to retirees. I'll tell you, this is a question that I have is when you look at those savings, and we bring it up on the screen, um, you look at the savings, a 95% reduction. When they were proposing to start Medicare Advantage on January 1st, they were just giving you a few months' notice. I don't recall them cutting your cost by 95%. So it seems like the state was not sharing that cost savings. At our subcommittee, the RHBAS, we found there's an awful lot of not keeping things straight between the three groups of employees and retirees under 65 and 65 plus. And there wasn't a high priority of keeping the cost from one group being paid by that group. But I'll tell you, I sure don't remember seeing the cost going down by $156 per year for those who were going to be thrown into Medicare Advantage. So yeah, as far as the shifting the payments to the retirees or the savings to the state, yeah, it's I understand where you're coming from. I'm not going to go further than that. The state was going to share in Highmark's profits from MA. Um, yeah, there's an in the weeds aspect there. In one sense, if our population was healthier than we led the winning bidder to expect, and the overall costs were lower, the state's saying, well, we want to share some of that savings. But you can also look at it and say, if you're denying 80% of the requests for approvals and you're not spending as much money, you shouldn't get all those profits. That should be shared with the state. It's a mess. But let me say one thing is, you can and maybe should draw your own conclusions about the value to society of Medicare Advantage. It has impact on the future of the country's Medicare system. These bills do not talk to that, and I don't talk to that. I'm focusing on Delaware, and I'm focusing on Delaware's budget, and I'm focusing on Delaware's employees and retirees and spouses. So I find that when I'm working on these bills, I'm not going to talk about national issues. One of the reasons is if I'm a colleague, that gives me a reason to disregard the rest of the conversation. I think I've got colleagues who are going to be focused on what's this mean for our state, for our constituents, our retirees. And if you start pointing out, well, this will lead to this or that, I think they can shut you out. You may say they shouldn't, but I fear that they could. So I want to give them the most reasons to keep listening. And going off on national implications, I don't think is constructive. That's my read. Lisa, any thoughts on that, or are you good?
Well, I think with regard to Medicare Advantage, I think one of the issues that we've seen, particularly in the New York situation, is there was this deal that was cut between the city and the unions that would have given the unions some of the, and I will put that in air quotes, cost savings, pushing the retirees into Medicare Advantage. And so there is always this behind the scenes what's happening with the money. Um, and, you know, part of the reason that the companies are so eager to get into Medicare Advantage is the fact that you actually have the flexibility once you get your cohort in there, as they find more issues with people. It's called to make a long story short, it's called upcoding. And basically, once they get you enrolled, they can get more money from the Medicare Trust Fund by documenting all these problems that you have. It doesn't mean you're actually getting the services, and that's one of the big findings with the stuff going on at the national level. But I do think what it means is that for folks who are, kind of looking at the total picture, we know that you're focused on what you need to do to get these bills passed. But for people who are interested in the broader picture, there's a lot of good information out there about this. And, I would just say if you look at articles in Stat from Kaiser, uh, the Kaiser Foundation has many reports. There are great places to get that information about Medicare Advantage, but you're focused on getting these bills passed. So, it's great for folks who are listening in to want to educate themselves, and there are great places to get that information. But I think part of what you're saying is keep the focus on getting the bills passed. And, we can do this other advocacy in other areas, but we know that you're laser focused on this and we understand that. So,
Guilty as charged.
yeah,
Absolutely.
yeah, we understand.
Okay, so let me see. And Anne Ray points out that one of the things about Medicare Advantage, and this is one that I am not an authority on, and we actually asked and did not get a crystal clear response. If you shift from a Medicare supplement, a Medigap, like a Medifill, to a Medicare Advantage, there are many configurations where you are not allowed, you're not permitted an automatic switch back
Right,
to Medicare, a Medicare supplement.
right.
It's not clear to me that if you're staying with, if the state were to switch back, that you wouldn't be able to go back. If the state kept the Medicare, if the state offered Medicare Advantage and you chose it because they weren't offering anything else, which is what they were proposing for 2023, and then if you said, "Gosh, this is no good for me, and I want to go to a Medicare supplement," um, not through the state, I think they would have the right to refuse you or to charge you much more because put you through the medical test and say you're a higher risk and we've got higher charges we're expecting, so we're going to charge you more. Does that
Paul,
sound
there
right?
actually are states that forbid insurers from refusing to allow people,
Yes.
that basically gets them out of the underwriting situation. And
Yeah.
so there are states that have passed legislation that says you can't do that. But that's the story for maybe another legislative session. But so we're going to get 281 and 282 passed.
Yes. Actually, on that topic, I've looked at it, and some states will give an automatic once a year. You have the right to go there
Yeah,
without underwriting.
exactly, exactly.
I spoke with the insurance commissioner Navarro about that, and there's implications. Anyway, I'm not going to address Mark Young's comment, but it's there in case you'd like to look at it. Let me see. Aside from state saving, would there be they would be saving money? Who would be profiting from the privatization of health insurance? So Christine asked, following: aside from the state saying they would be saving money, who would be profiting from the privatization of our health coverage? Here again, I'm going to lean on what Lisa said, which is I'm laser focused on getting this through. Um, and I and actually I heard this directly from Joe Biden when he was vice president, and he said, focus on actions, not on motivations, because you can't get in someone's head and understand the motivations. Might somebody be motivated by being on the receiving end of the privatization of health coverage? Absolutely possible. Do we know that? No. So I'm not going to worry about that. I'm going to look at the factual. It was going to cut the state's cost from 3,200 a year to zero a year, and that's not a benefit. That's factual. I don't need to look in someone's head to say that happened and share my conclusion that that's wrong. I don't want to go further into presuming what motivations are behind people's actions when I think the actions alone speak for themselves.
You can email me at risedelaware@gmail.com. I have an opinion on that, and it won't be on Paul. So,
So I'm putting risedelaware@gmail.com in the
yep.
comments, so you can cut and paste that into your email.
And Paul,
Um,
if there are folks who are not on our email list and they want to be, and they're not strictly Facebook people, if they go to our website, which is risede.com, they can go to the join page and just type their email address in and their name, and they will be automatically put onto the email list.
Okay. The list. Okay, I just transcribed that. Um, okay. So Linda Olson asks, the governor recently said costs were going up 27%. Was this to stampede everyone with fear? So again, I'm not going to infer any motivations, but let me explain the 27% increase. Um, the it was because the costs are higher than they were receiving money for. We've been living on borrowed time. As soon as the GHIP, the group health insurance program, had built up over years a surplus, and as costs were going up, instead of raising premiums each year, they let them be stagnant for several years, and it ate up the surplus, which meant we were spending more than we were receiving. Yes, the federal government gets to do that. State government doesn't really get to do that. So we were deficit spending, and we no longer, that trust fund is running out in the next like 2 months or so. So we need to bring in enough money for what we're paying today, and even increases that we're not expecting but could come up later this year and early next year. Um, the increases are completely untied to this issue, other than this issue came up because the rate of healthcare costs has been rising steadily, and the state understandably made promises to its employees that we're there for you when you're an employee and when you retire. And the state, in not a terrific show of character, failed to put any money towards those promises.
Yeah.
And finally, accountants and accounting rules said you can't sweep that under the carpet. You have to disclose that every year. And bond rating agencies started looking at it, and that could mean that we could get downgraded and have to pay more for the debt for things like putting up schools and roads and stuff. So finally, Delaware said we have to address this funding gap, and the 27%, the increase that led to the 27% is just a symptom of this overall problem of very high medical costs countrywide. However, our subcommittee also noted that in Delaware, it's worse than our neighbors. And frankly, it should not be worse than our neighbors. But it's worse than our neighbors. And one of our recommendations to the legislature and the governor is to address that. And my co vice chair, Senator Brian Townsend, is the lead on that. And he's actively working on introducing steps for that. I will say that in a typical legislator approach, was, hey, let's do a task force to study it. And Brian's like, oh, Paul, please, we have studied the living crap out of this. We know what we need to do. We just need to get the resolve to do it. That's going to be another thing where support from retirees and employees and spouses will matter. We don't have a bill yet to talk about, but stay tuned on that one. Okay, so that's the 27% piece. Do you want to jump in, Lisa?
I just wanted to say, I think it's good for people to know. I mean, when we first started Rise, we thought, oh, this will be over soon. And as we've gone along, we know that it's we've got to just keep paying attention. Um, Paying attention to healthcare issues, it's not going to go away. And so I kind of feel like my retirement has upended and I'm now working for Rise instead of doing other things I wanted to do. But, we've got 30,000 people out there, but then think about all of the state employees who are coming after us. So we have a lot of work to do, and I appreciate what Paul is doing. Um, but we know that there's more to be done beyond HB 281 and 282. So stay tuned, because the work isn't over.
So apparently Lynn Anderson was listening to what you just said, and her comment was, thank you, Lisa. So
Thanks.
John Kowalko points out that it is an election year, and frankly, that was the astounding part, that this whole debacle was uncovered in 2022, which was in another election year. It's a really bad time to either piss off or embarrass legislators. So anyway, John Qualco points out this is an election year, so be heard. I mean, there will be, every member of the House of Representatives is up for reelection. Half of the senators are up for reelection. They will have events in which they would like to earn your vote. You can make it clear to them that what they do on 281 and 282 affects whether or not they earn your vote. That's how democracy works, and thank goodness. Okay, so Connie points out they got off to the wrong. Sorry, Connie Dobson Bailey says they got off on the wrong foot when they lied to us and said it was going to be better or at half the cost. Insurance companies never give better coverage for less money. Yeah. I think what's it? See, good, fast, cheap. Choose two is I think a phrase I had heard. So yeah, half the cost and just as good. You know what? I may have a bridge to sell you. So who's on the admin committee? So I'm going to type in here. I'm just going to say rep, short for representatives. So the speakers, Speaker Longhurst. The House Majority Leader is Pino Brown. I wish I could spell. And then Carrie Evelyn Harris. And then on the Republican side, we have Representative, the Minority Leader Ramon, and Minority Whip Urick. So those are the 5 members on the House Administration Committee. Okay, Bobby, I see a lot of publicity now about healthcare costs. Even more is now spent on education. Now, perhaps publicity on the affordability would be helpful at this time. Yeah, Bobby, you're right. I think that when Senator Townsend is ready to bring out action to bring those healthcare costs, I would imagine that we will have some, I hope and imagine we will have some good effective publicity on the unaffordability in Delaware versus our neighboring states. Did the governor signal that he will veto 281 and 282? I've not heard either way. I think it's safe to say that they are not his favorite 2 bills that have been filed by the legislature in the past year and a half. So I'll just leave that there. But let me back up. No, let me listen. That was unfair. It is my responsibility as the sponsor, the prime sponsor of these 2 bills, to do everything I can to get good legislation passed into law. There are paths to getting it passed into law. It's often described as sausage making. Given it's Delaware, I think it's more of scrapple making, where sometimes you don't want to know what goes into it, but you're trying to get something that is tasty at the end. It makes the difference. And that's my job. It is, what's the phrase I've heard? Don't ask an attorney for medical advice. Don't ask a doctor for legal advice. And the legislative process, again, it's scrapple making. We're doing everything we can, and I'm doing everything I can to get frankly, I love 281 and 282. Am I willing to make some tweaks in order to get more votes on it and get I'm absolutely hopeful that we can get to a point that the administration, the governor and his office can sign the bill into law. And I have had conversations, and I'm always open to those conversations. I also have guardrails that I will stay within. So that is the process of making scrapple. So we will see. It is way too early I think it's way too early to ask that question because legislation is an evolution of an idea into a law, and so we will see. The bills are not an immaculate conception. So it's here's what one person would like, and now let's see how many of my colleagues can join in, and can we get the executive branch to also support it is the task. Okay, how much dollars can be saved by switching to the 2 Medigap plans you mentioned? Karen asks. And so I looked at those Medigap L and G. It depends on how it is instituted. Is it instituted today for every 65-year-old plus retiree? Is it for everyone who retires in 2025 and beyond? Is it for everyone who 65 plus who retires by 2025 or later? Is it only for those who start their job in 2025 and beyond when they eventually become age 65? The answer is it depends on what assumptions you put in there and how it's implemented. Percentage wise, for whomever that affects, you've got a 16 or a 38% reduction. But if you're only affecting 2% of the population because it doesn't take effect for a few decades, then the total dollars is pretty small there. Thank you for the subcommittee for deep dive into data. Bobby, you are a glutton for punishment and generating these reasonable House bills based on your comprehensive work. You are most welcome, Bobby. Karen, grateful for your tremendous work. Thank you. Linda Olson, thought so even back in the original presentation in 2020, wherever you heard it. Goodness. It's stunning to find your own state in bait and switch. Christine, if the bills pass and are signed by the governor, will that end the court case that's in progress? Great question. So I'm not sure who caught it, but there was a Delaware Supreme Court hearing this past Wednesday, right? The 31st.
Yeah.
31st. It was for all of 40 minutes. It was fast. It was sort of as, I don't know, it didn't surprise me afterwards. I'm like, yeah, I guess that's actually what I sort of expected. Sorry, it was live streamed. That surprised me. And it was within the range of what I expected. It's really independent of the bills, of these two bills. There's another bill I didn't file that it would have had some impact on, but does it really, these are parallel courses as far as the legal case and these bills. The legal case largely addresses the past, and these bills completely address the future. So therefore, the passage of these bills and them becoming law, I don't think really has any direct impact on the court case, other than, and this is my goal, I don't expect any future court cases of this nature when we pass 281 and 282 into law, because with their transparency and their accountability, I don't think there will be ever a future group of retirees who can complain as effectively as this group has because of the action that the SCBC went through in the past few years. Lisa, your thoughts?
I think you're correct. I think that the court case is the court case, but we're focused on getting this passed to correct the problems that we saw, such as lack of notification, lack of transparency. So, yes.
So John Kowalko asks, when we get the committee hearing and he plans to be there, should we have a show of polite strength? I love that. Yes, I love shows of polite strength in numbers at that hearing. Yeah, and John, you know this. Having something in common, whether it be a sticker, whether it be the same color T-shirt, whatever, it could be the same baseball hat, whatever it happens to be, buttons, okay? But have it so that from 5 yards away, you can see you're here because of 281 and 282. And you're here because you want and expect support and release of that bill from the House Administration Committee. I think that it would be very advisable if you'd like to have the bills passed. And frankly, your presence on the day that is heard by the Administration Committee and presumably is released will also have an impact on the other legislators who see that, who aren't on that committee, but see you in Legislative Hall with the same button, with the same hat, whatever it is. They're like, geez, they really show up. They really care. And if they show up in March and they show up when it's heard on the House floor in April, Senate committee in May, Senate floor in June, you know what I think? My guess is they're going to show up in November. They're going to show up in the primaries in September. You showing up on this is going to mean a lot, and I think it's really, really helpful.
And Paul, you'll stay in contact with us to let us know so we can get people out for that.
So because I email you
Yes.
when there's upcoming RHBAS, which I'm defining in a second. When there's changes there, indeed, when there is a meeting announcement, I had wrongly assumed that it was going to be heard in January. That was my bad. And I will wait until I have a high level of confidence before I do that again. It's sort of like a false labor or something. So I don't want to do a false alarm on that. Yeah, I will let you know when that meeting is scheduled with the bill on the agenda for that meeting. Okay. Oh, good. I'm sorry, Kathy, you already answered that, so I didn't have to do that. Rise Delaware's website, publicity sway against these, aka publicity. Oh, Bobby asked something about sway against these House bills. Um, Let me look back to see what you're pointing to, Bobby. 'Cause I get the feeling it's something good. Generate these reasonable House bills based on comprehensive work. That's not it. I see a lot of publicity. Oh, I see a lot of publicity now about healthcare costs. Perhaps publicity on the affordability would be helpful at this time. Okay, so I had to put these comments together. Um, so Bobby is raising the issue of, can the publicity about higher healthcare costs be used to try to sway a legislator to not support the bills, since the bills are not support the bills because the bills are designed to limit the state's ability to cut health benefits, which are becoming very expensive. Yeah, no, yeah, that it can be. I know that when I hear from those, they were unnameable, of sharing their lack of pleasure at the bills. They almost always focus on cost and or options, and healthcare costs. There's no question about it. But you know what else costs? Promises cost. And we've made promises to people who have worked 36 years for Colonial School District, and we can't ignore them now. So yes, does it cost money? Yes. Is it getting more expensive healthcare in our country? Yes. Is that something that we can solve ourselves right now in Dover? We can play around the edges, but it needs national changes. That's a reality. But we made promises to that teacher for 36 years who came to our schools and helped our kids and our next generations, and we have to deliver on that. And it doesn't mean that we cut the benefits by 95%, because healthcare costs go up. That's nice. That's a responsibility of the employer, in this case, the state of Delaware. Sorry, I got on my soapbox. Um, okay, that was Bobby's. Well, the insurance will profit and the state will profit through incentives and a lowered cost. One of the things about what Senator Townsend's working on and bringing the cost, we're just asking for costs in Delaware for inpatient and outpatient procedures to be the same as it is across the stinking state line in Maryland and Jersey and Pennsylvania. We're not asking, like to put insurance companies out of business or hospitals out of business. We just want to not be the fools in the region and the state that pays the most for everything. That's insane.
And
Um,
and Paul, just in fairness to that issue, that was raised in the RHBAS by Bill Oberly as well as just Jeff Tashner.
yeah,
So the concern, and retired Representative Oberly mentioned that over the years he has been very concerned about the difference between healthcare costs in Delaware and in the surrounding areas. And, one of the things that we can push for once that legislation is created is to get some real information, because you can't blame the people who are receiving the health care for the costs if you're not doing anything to really either bully pulpit or legislate some cost containment for that.
yeah,
So yeah, that is definitely an issue that I think that once it's raised, once you've got legislation and a path forward, Rise would want to be on top of that.
yeah, yeah. I mean, the subcommittee has been last year met 20 times since, I mean, 2 and 3 hour meetings. We covered a lot of territory, and there's a lot of
Mhm.
opportunities to make things better in Delaware that are coming out of there. So yes. Okay. Lisa, there's thank yous. Where can I find the House documents? Sandy, there is a link earlier in this chat that has the links to each of the bills. So Steve Beard asked, what about candidates for governor? Should we be contacting them too? I think the answer is yes. Now, keep in mind, one of them was is the chair of the RHBAS subcommittee, but nevertheless, it's still very helpful. I think it's very constructive and quite appropriate if someone is coming to ask for your vote to be our next governor, and that governor will be naming several members of the state employee benefit committee. I think it's pretty reasonable to ask them or to share with them what you're hoping the next state employee benefit committee looks like and how it's run and how it views retirees. how it values its retirees and its promises to those retirees. Absolutely, I think it's wonderful, wonderful point, Steve. I appreciate that. Um, oh yeah, so Barbara points out that just about every member of the House Administration, almost every member of the House Administration Committee, a majority of them are co-sponsors of one or both of those bills. So it's not that it's a lock, but listen, you guys have worked your tails off. That's the only reason we have so many names there. I'm sorry. Those are also really good bills. That's also another reason we got lots of names on there. But together, the House Administration Committee should not. I don't think that's going to be a stumbling block on passing it, getting it scheduled, getting it through. I'd like to get it through both chambers sooner, but we'll see how we can go. Right. Okay. So the links are in there. So Kathy Brown says, when is the vote? I don't know. When we know if it passes, live out of state. So Lisa mentioned before, and I typed this in. If you go on to the Rise DE website and add yourself to the mailing list, you will be told when the committee meeting is scheduled, and for that matter, when it's on the agenda for the House floor. So just stay in touch with Rise, and you'll find that stuff out. I'm for those of you who are, I happen to have a Facebook page. I do post a bunch, but I can be overwhelmed and I may not put it out as laser focused as Rise will, which this is their one issue. So yeah, I think they're a great resource for that. Okay, so we are lots of thank yous, and thank you for that. And yes, as Karen points out, Bethany Hall Long has supported 281, 282. I'm sorry. Is it true that Bethany Hall Long supported 281, 282? Um, um, I'm not going to say one way or the other. I did not ask her directly and did not get a direct. Therefore, I can't say. I don't want to speak for her. I would. She certainly knows all these issues since she's been at the head of that subcommittee that's looked at these issues. It's so ask. I don't mean ask her of try to catch her. I mean seriously, just have a chat with her. She's an amazingly smart and nice person. So ask her and just say, where do you stand on 281 and 282? And if someone else has had that conversation with her already and can share, that's fine. I have not, frankly, and I mean this with full respect. She doesn't have a vote on it. I've been working my time with those who can vote on it. So I've been speaking to representatives and senators, not to lieutenant governors. That's my way of not answering because I don't really have a good answer. Lisa?
And I would say that one of the things that I found with the RHBAS, and I would certainly I think it was because of both Paul's leadership and the lieutenant governor's leadership. That subcommittee absolutely modeled the openness and transparency that you would hope a government process would model. I mean, there was just an opportunity for people to speak and make comments. And so I certainly think that Paul's bill modeled the way that he and the lieutenant governor ran those meetings, certainly, and would like to see more of it in other parts of government. So
On
I'll
that
just say
point,
that.
yeah, on that point, I know that after, especially once we were like 2/3 of the way through the year, and we had seen what we were able to do and how we were able to work collaboratively with members of the subcommittee and the public and the staff, that I've spoken directly to the lieutenant governor about this, and this is to me and to her a clear example of how we should be having our public bodies operate. And we both have said to each other that we hope that our other task forces and other public committees operate in this way. That's yeah. Thank you, Lisa. That's a really good point. So Connie asks, is the email a closed list or can everyone who signs up be added? So Connie, I'm sorry, Lisa, you mentioned that if you go to that site and do the join and enter your name and your email
Yeah.
address, you will be added, correct?
Yes.
Okay. Um, and wow, we're at the end of the comments. How's that? And we're only at an hour and 20 minutes. Um, Lisa, thank you for the opportunity, and thank you for joining me, and thank you, your daughter, for helping us with the technology.
I know. That's the benefit of having somebody younger in the house.
Lisa, quick question. Roughly how many emails do you have on your list?
We have over 700, 1,700. So,
Yep.
and I do have to say, one of the things we keep finding about these mass email systems is that when you sign up and you get the email that says add elisa.diller@risede.com to your email, to your list of contacts, please do that, because that signals to your email system that you want to receive Rise emails. Um, the great thing about Facebook is once you're on it, you can engage there with email lists. What we found is particularly those folks who have the Microsoft based email systems, they are really good at kicking out what they see as commercial email messages. So sometimes you have to work really hard adding us to the list of contacts and then going into your spam and trash and seeing if they're ending up there.
So I have two things. One on that, my spam blocker was blocking my newsletters, my e-newsletters, my e-blasts.
Oh gosh.
so,
Okay.
so
Yeah.
I've been there, done that. And just because we can, I want to reinforce what we said very early on, which is when you're reaching out to legislators, respectful, civil, something along the lines of, "Hi, how are you? I'm your constituent. Thank you so much for all you do. I'm writing about 281 and 282. It's important to me because why it's important to you, say, I'm not, if you don't know, say, I don't know whether you currently support them. I encourage you to, or if you already do, thank you very much. If you haven't, please give it a look and consider signing on and supporting it. And thank you very much for your time. I mean, just keep it positive. Keep it, the last thing you want is to annoy somebody who's going to be voting on this. You only want to build them up. As much as you can do that, share the love, but share the passion and the concern. And Anne Marie points that we had 28 members tonight. Wow, excellent. 2,800. Sorry, I missed that. There's 2 zeros. Thank you all for joining us. And I think we need a rest now. So Lisa, thank you so much for your time.
Thanks, Paul.
Take care, everyone.